everyone, my name is Belita Savage. Welcome to my channel. I'm a nurse practitioner here in London, Ontario, and I am here to talk to you a little bit about what Botox can do for you. So you will be hearing the term Botox used. Botox is actually a brand. So if you think about, dish detergent, you're gonna hear different brands within. So you have Palmolive, you've got Dawn, you've got No Name, you name it, all different kinds, does all the same things, washes your dishes. So if you think about it in medications, which Botox is a medication, Botox is actually a brand name of a class of medications called neurotoxin or neuromodulator. And sorry I did this umbrella because I usually term class of medications as an umbrella, and then specific brands fall underneath the umbrella, and it kind of makes more sense that way. So within the term of neuromodulators or neurotoxin, we have different brands. One of them is called Botox, which is the OGs of neurotoxin. We've got Dysport, we've got Xeomin, we've got Nuceiva, one of the new ones is called the Tipo, here in Canada at least. So they all have different molecular differences. They've been created in different pharmaceutical companies, and essentially, once it's injected by a registered health professional, it can help to reduce muscle movement or hyperactivity of muscle movement and essentially soften fine lines and wrinkles when it comes to the cosmetic purposes. Neurotoxins such as Botox can also be used medicinally, and one of the main diagnoses for chronic migraines. It can also help with hyperhidrosis, which is excessive sweating of the armpit. And there are many other off-label uses which can be used for other medical diagnoses, which we're not talking about today, but that's something that I can talk about in a different video. So with neurotoxins, or Botox, that a lot of you would name it, essentially, we use this medication to dose appropriately for patients to help soften their fine lines and wrinkles. When we look at areas like in between the brows, we usually term that 11s or forehead lines. We've got crow's feet, bunny lines. We've got lip wrinkles, also known as smoker's lines. I don't really use that term because non-smokers can still also have lip wrinkles. We can also use them for the masseters to assist with any tension, bruxism, clenching, but we can also help with cosmetic slimming as well. We can do it in the chin. We can do it in the DAOs, which is to help with that frowny smile. And then we can also do them in the platysmal bands. And this is all for cosmetic purposes. A main question that I get regarding Botox is, what is my dose? Well, again, every person is made up differently. Anatomy is different. Strength of muscle is different. Between males and females can be different. So there's a lot of identifying factors that need to be taken into consideration when it comes to your dosing. It's like when you get a specific medication for hypertension, so like high blood pressure, one person might do better with one medication versus the other. One might need more higher dose of perindopril than the other to lower their blood pressure. It's just an example, but you just have to remember that at the end of the day, Botox or neurotoxins in general are medications. So it's very patient specific. Just because your one friend got 30 units doesn't mean you're going to get 30 units. You might be under 30 units, you might be over 30 units, and it also depends on the areas of treatment that we're targeting. When you get Botox injected, one thing you want to note is that it does not kick in until maybe 3 to 5 days, if not 5 to 7 days, to a maximum of 2 to 3 weeks. And at 2 to 3 weeks is when you really see the relaxation of the muscle. You can't really quite move your muscles as heavily as you used to, and therefore reducing the fine lines and wrinklings within that area of treatment. As you can see, there's so many uses and so many indications for Botox or neurotoxins. With the right provider, they can give you the proper assessment, proper consult, guide you appropriately, and dose you appropriately so that you get that longevity of this medication for 3 to 4 months. Ask the appropriate questions and plan it accordingly. You don't want to be planning your Botox treatment 2 days before you're getting married, or if you're going on vacation in 3 weeks, you want to make sure that you get your toxin treatments done 2 to 3 weeks prior to your vacation. Those are just examples. Hopefully you found this video very helpful and gave you a little bit more information regarding Botox treatments and what it can do for you. So if you like this video and want to see more content, don't forget to comment below with any sort of videos or questions you might have regarding treatments, other things you'd like to see. And then also don't forget to hit the subscribe button and the like button, and I can't wait to see you guys next. Take care.